So in this video we are going to deal with the muscles of anterior compartment of the thigh. So mainly the anterior compartment of thigh have the muscle like sartorius. So you can see here this is the sartorius, which is an oblique muscle. Okay, and next you have the quadriceps femoris. So this muscles, the set of muscles are called quadriceps femoris. It is not only one muscle, there's a group of different muscles. We'll discuss it later. So that is called as quadriceps femoris. And also you have articularis genu. Articularis genu is also one of the part of Vastus Intermedialis. About that also we'll discuss later. So, and in addition to this muscles, we also have some other region muscles like in front of the thigh, like Iliacus and Swas major. So you can see this is a Swas major and this is the Iliacus muscle, right? So this both are also included here. And next you have, they are actually forming the part of floor of femoral tank, that is the Swas major muscle and Iliacus. They form the floor of our femoral triangle. Okay, and next you have their, actually this origin of this muscles like Swas major, Iliacus is from the abdomen, and you have the pectineus and adductor longus. So if you see the pectineus, adductor longus, these are also the anterior compartment muscles. So you can see this is the pectineus muscle and this is the adductor longus muscle. Okay, so these are also different muscles. They also are seen in relation to femoral triangle, right? But if you see this pectineus muscle and adductor longus, they are medial compartment muscles. We'll discuss them later. Now our main focus on the anterior compartment muscles. So whatever I said, one is the sartorius, next is quadriceps femoris, next articularis genu, and next you have our Swas major and Iliacus. So remember these muscles, these are the anterior compartment muscles of our thigh. So if you see, coming to the sartorius, it's a long narrow muscle, ribbon-like muscle. It's running downward and medially across the front of the thigh, and it is the longest muscle in the body. Its attachments are like we'll discuss later. First we will see the general features. Okay, next coming to quadriceps femoris muscle. It is so called because it is consisting of four parts. One is of rectus femoris muscle. So one muscle is the rectus femoris muscle. We'll have it here, and the next muscle is actually this rectus femoris, and next vastus lateralis, vastus medialis. So you can see this is vastus lateralis muscle, and next you have the vastus medialis muscle. This is the rectus femoris muscle. So rectus femoris, vastus medialis, vastus lateralis, and vastus intermedialis. So if you open the vastus medialis muscle inside and you see, then you will get the vastus intermedialis muscle. It is not visible in this diagram. If you check out the rectus femoris muscle, it's fusiform shaped and it runs more or less vertically on front of thigh, superficial to the vastus muscles. The three vasti are wrapped around the shaft of femur in position indicated by names. So attachments of components of quadriceps femoris we'll discuss along with the nerve supply. Next, coming to articularis genu, it consists of few muscular strips that arise from the anterior surface of shaft of femur. Okay, and few centimeters above patellar articular surface. Here at the rate of here, articularis genu originates. So mainly they are inserted into the upper part of synovial membrane of knee joint. They pull the here upper part of synovial membrane of knee joint. They mainly pull the synovial membrane upwards during extension of knee, thus preventing damage to it. Okay, so nerve supply of all this anterior compartment muscles of thigh is mainly by femoral nerve. As femoral nerve will be passing here, all these muscles are supplied by femoral nerve, and the femoral nerve root values already we discussed, L2, L3 and L4. Okay, so actions of these muscles. The sartorius, if you come into the sartorius, it's an abductor. Abductor means pulling the leg away from the body side. Okay, so it's an abductor, of course a lateral rotator of the thigh, and it is a flexor for the leg. You may get the doubt that the anterior compartment muscles are extensor muscles. Then why sartorius is flexing the leg? Remember, sartorius is extensor for the thigh, but it's a flexor for the leg. Okay, so it's an abductor, lateral rotator of thigh, and the flexor of the leg. It is not also, actually in the extensor compartment muscles you have some exceptions. One of it is sartorius. It's actually an abductor and lateral rotator of thigh and flexor of the leg. Okay, so it is mainly involved, all these actions are mainly involved in assuming the position in which the tailor sit and work, that is palpi position or Sartor-Taylor. So actually Sartorius name is coming according to Taylor. How the Taylor sits, you can understand that position, right? On chair if you sit, according to that position it has got this name. So next, coming to quadriceps, it's a strong extensor of the knee joint. This action is very important in standing, walking, running. In addition, rectus femoris, you can see this one, it is maintaining the posture. Okay, it fixes mainly. In addition, the rectus femoris fix the hip joint along the iliopsoas and help to maintain erect attitude. So erect attitude is mainly maintained by rectus femoris. Okay, and also you have vastus medialis, which prevent lateral displacement. Okay, this one is vastus medialis, which is preventing the lateral displacement of patella. Okay, and the muscle is tested mainly by attempting to extend the knee joint against resistance. So if you extend the knee joint against the resistance and palpate the contracting quadriceps muscle, so like that you can palpate it. You can see here the test which is given here shows how to test quadriceps femoris. So like this, if you put your knee joint, your leg like this, okay, and extended your thigh, then you can feel the muscle over here, that is mainly your quadriceps femoris muscle. Okay, so like this you can test for this. Now we will discuss about the muscle origin, insertion. Okay, so let us start with our sartorius muscle. So this is the sartorius muscle, oblique muscle. So sartorius is getting its origin from the anterior superior iliac spine. You can see here, from here, and also in the upper half of notch below the spine. So here, upper half of notch below the spine. So from here the sartorius will get its insertion origin. Okay, and it will get inserted into the upper part of medial surface of shaft of tibia in front of insertion of gracilis and the semitendinous. Actually, gracilis and semitendinous are also attached on the medial side of the tibia. So there only, on the medial side of tibia, you will get attachment or insertion of our sartorius muscle on the upper part of medial surface of shaft of tibia. Okay, so origin from anterior superior iliac spine, below you have a spine, from there it will origin and insert into the medial side of tibia upper part along with the gracilis and semitendinous muscle. So now we'll discuss about the quadriceps femoris, its different muscles and its attachments. So first, in the quadriceps femoris, we'll talk about the rectus femoris muscle. So if you see the rectus femoris, it's fusiform superficial fibers, they are bipinnate deep fibers. Okay, so it is getting its origin from, it is having a straight head and reflected head. Okay, its straight head is getting origin from upper half of anterior inferior iliac spine. So if you remember anterior inferior iliac spine, from there it will get its origin. Okay, especially its straight head. Okay, and it is also having a reflected head that will get its origin from the groove above the margin of acetabulum and capsule of hip joint. So if you remember the rectus femoris, it is getting its whole origin from the ilium bone, right, which is a hip bone, right. So from there it will get the origin and it will get inserted into the base of the patella. So you can see here it's tendon and it is getting inserted into the base of the patella. So this is about rectus femoris. Next, coming to vastus lateralis. So this lateral muscle is vastus lateralis. It is forming a large part of quadriceps femoris. Its origin is linear. Its line runs from upper part of intertrochanteric line, anterior and inferior border of greater trochanter. Actually, this is coming from the femur, on the femur upper part of intertrochanteric line, and also it is coming from anterior inferior border of greater trochanter and passing from the lateral lip of gluteal tuberosity. From there it comes to the upper half of lateral lip of linea aspera. So it is having four origins. That is nothing but, you can say, the vastus lateralis is taking its origin from the shaft of the femur, right, that is upper part of intertrochanteric line. If you remember, the intertrochanteric line will be on the anterior surface, right, and also it will come from the anterior inferior border of greater trochanter. Okay, and also it is coming from lateral lip of gluteal tuberosity and also coming from upper half of lateral lip of linea aspera. Linea aspera is on the posterior side. On the posterior side, especially on lateral lip, it will get its origin. And this vastus lateralis, finally it will get inserted into the lateral part of base of patella, and also in the upper 1/3 of lateral border of patella, and expansion to capsule of knee joint, tibia, iliotibial tract. So it is participating in many things. It is coming to lateral part of base of patella, into the upper 1/3 of lateral border of patella, and also taking part in expansion of capsule of knee joint, tibia, iliotibial tract. So next, coming to the vastus medialis. So vastus medialis is taking origin is linear. The line runs from lower part of intertrochanteric line, and it also passes on the spiral line. If you remember, the spiral line is nothing but it's a medial lip of linea aspera, right? So that spiral line, and also it is coming from medial lip of linea aspera, and also from the upper 1/4 of medial supracondylar line. So from there we will come and insert into the medial 1/3 of base of upper 2/3 of medial border of patella. So in simple terms we can say that vastus medialis and vastus lateralis, they are both coming from the shaft of femur, and they are getting inserted into the patella. That's it. Next, coming to vastus intermediate. The vastus intermediate is it's coming from upper 3/4 of anterior lateral surface of shaft of femur, and it is of course getting inserted into base of patella. So patella is a sesamoid bone in a tendon of Quadriceps femoris. The ligamentum patellae is actual tendon of Quadriceps femoris, which is inserted to the tibial tuberosity. If you remember the ligamentum patellae, it is also actually a ligament of Quadriceps femoris. It will get inserted into the tibial tuberosity. So in summary, we can say that all the vastus muscles, that is vastus lateralis, medialis, vastus intermedius, all are getting their origin from the shaft of femur, and they are getting inserted into the patella base. That's it. So no need to remember all the specific features. So rectus femoris, of course, it's coming from the anterior inferior iliac spine, right? And reflected head is coming from the acetabulum, you know about this, and it is getting inserted into base of patella. So this is about Quadriceps femoris origin and insertion. Now we'll discuss about Iliacus and Swas major. So you can see these muscles, right? So Iliacus, these muscles are forming the lateral part of floor of femoral triangle. They are classified as muscles of iliac region, and also among the muscles of posterior abdominal wall, since a great part of their fleshy bellies are in posterior abdominal wall. They'll be described actually in abdomen more detail. So however, on account of the principal action of hip joint, they are like both have the common insertion on lesser trochanter of femur, and are chief and powerful flexors of hip joint. So they are powerful flexors of hip joint, and they both are having common insertion. Remember that is on lesser trochanter of femur. Lesser trochanter means it's on the posterior side of the femur. Okay, so because of their common insertion and action, the two muscles are often referred by common name Iliopsoas. So they can be called together as Iliopsoas. Okay, so both are supplied by spinal segments of L2 and L3. The Swas is supplied by branches from nerve roots, whereas Iliacus is supplied by the femoral nerve. If you remember, the femoral nerve, before passing into the behind the inguinal ligament, it gives a nerve to iliacus and also nerve to pectineus, right? So that iliacus is supplied by femoral nerve, whereas the psoas is supplied by branches from nerve roots of L2 and L3. So this is all about the anterior compartment muscles, and now supply, everything, action, everything we discuss. Once again, quickly let us recall everything. So of course, first we'll start with the muscles. What are the muscles of anterior compartment? The first one which comes is sartorius. Next comes the Quadriceps femoris. Next comes the next comes the articularis genu. Okay, after that comes the psoas major or iliacus. Both together are called as iliopsoas. Okay, so these are all the muscles, just easily can remember. So first one sartorius, next one Quadriceps femoris, articularis genu, psoas major, iliacus. So if you go in detail of their insertion, origin, everything, sartorius taking origin from anterior superior iliac spine, getting inserted on medial side of upper part of tibia, right? And its main action is lateral rotation and abduction. Okay, and next coming to Quadriceps femoris, all these are formed by different vastus muscles, right? Like vastus medialis, lateralis, intermediate, and also of rectus femoris. Rectus femoris origin we know already, it's coming from our iliac bone, especially rectus femoris head, it's coming from anterior inferior superior iliac spine, and the reflected head is coming just above the acetabulum, right? And it is getting inserted into the patella, upper part of patella, right? And next coming to vastus, all this vastus muscle, lateralis, medialis, intermedialis, all are taking origin from shaft of femur and they're getting inserted into base of patella. That's it. Next coming to Swas muscle, iliacus, actually they are posterior abdominal wall muscles, but both are having common insertion, that is they are inserted into the lesser trochanter of the femur. Hence both can be called together as iliapsoas. Okay, so both can be called together because of their common insertion. So that's it. This is all about anterior compartment muscles of thigh. Next we'll discuss about the canal. So next we are going to discuss about adductor or hunters or subsartorial canal.